In this lecture, we will be discussing the different surgical approaches for hernias depending on where they are located. To start with, we are going to discuss umbilical and inguinal herniorraphy. For an umbilical hernia, the surgical site preparation is the same as the exploratory laparotomy. The hair is clipped around the hernia liberally. For reducible hernias, palpate the hernial ring and reduce the contents as much as you can with gentle inward pressure. A ventral midline incision is placed over the umbilicus. For irreducible and larger hernias, an elliptical incision, as seen in the image on the right as broken green lines, is made around the base of the hernia and excess skin is removed. Once inside, assess the viability of the contents. As we talked about in the previous video, assess the general appearance, the color, and the capillary refill. How do we do that? Well, remember how you were able to assess the capillary refill time for the gums? Same thing. Gently pinch the intestine and wait for it to go blanch white. Let go and check if its pink color returns. Also, check the mesentery for any adhesions and the pulsation of the vessels. If it is viable, simply put it back inside the abdomen. If not, and it is the intestine that was herniated, intestinal resection and anastomosis might be indicated. We will be discussing this in detail in the surgery of the intestine. After the hernial contents has been replaced back into the abdominal cavity, the hernial sac or the bag where it is contained is excised and the wound edges are opposed. Do not forget to trim the edges until healthy bleeding is observed. The muscle layer is then opposed, making sure no holes are left to prevent reherniation. Remember, hernias happen because of muscle weakening or probably because of trauma. But for the umbilical hernias, which has been present since the animal is born, this is because of muscle weakening. Assess the muscles when you are trying to put your bites of suture. Make sure that you place the bites wide apart through the muscle to make sure. A simple interrupted or horizontal mattress pattern may be used. Large hernial rings may need to be opposed using non-absorbable suture material to manage the tension, compensate for the muscle weakening, and make sure that it heals for a long time. When I mean heals for a long time, that your suture is there for quite a long time because it will compensate for the weakness of the muscle around it, just so your herniorraphy will not fail. The subcutaneous tissue and the skin are closed routinely. For inguinal hernias, the contents protrude through the inguinal ring, which is a normal intra-abdominal opening. Sometimes, this condition is mistaken for mammary tumors, cysts, abscesses, or even a bad hematoma. Diagnostic imaging and intensive, correct palpation helps narrow down your diagnosis. Incision is made through the caudal abdominal midline incision, right here. The skin is retracted laterally, and the subcutaneous tissue around the area of the hernia is bluntly undermined and dissected until the hernial ring is exposed. The hernial sac is then opened and inspected for adhesions between the sac and the herniated contents. Once viability is checked, the contents are replaced back into the abdominal cavity with gentle pressure. The hernial sac is then excised at its margins and sutured closed with a simple continuous pattern. The sac is then placed back inside the ring. The hernial ring is then trimmed at its edges and closed with a simple interrupted suture pattern with a non-absorbable suture. Again, you would need a non-absorbable suture because you would want the suture to stay there for quite a longer time than an absorbable suture because it needs to serve as the anchor or the mesh or the net that keeps the muscle together. The subcutaneous and skin layers are routinely closed. You have an option to place a Penrose drain before the skin is closed to help manage the dead space and to let any seroma drain out of the wound. A post-operative abdominal wrap or bandage may be done for patient comfort. To see how correction of umbilical and inguinal hernias are done in real clinical cases, check out these videos from VetRanch from YouTube. Focus on the diagnostic methods used and his surgical approaches. Thank you, until our next video.